Hello, everybody. I'm Dr. Erika Moody, and I'm with Pelvic Rehabilitation Medicine. I'm a physiatrist here. This is my first Instagram Live, so you'll have to bear with me with the technology. So let me know where you guys are from. I'm in Texas, in Dallas, and we're having a storm coming in today, so it's quite chilly here. All right, so again, my name is Erika Moody, Dr. Erika Moody. I'm with Pelvic Rehabilitation Medicine here in Dallas, and I'm here to discuss today pelvic floor dysfunction in males. So I'm going to go ahead and get started because it's 4:01. So I'm going to start by just defining what the condition is. So pelvic floor dysfunction refers to a broad constellation of symptoms and anatomic changes related to abnormal functioning of the pelvic floor musculature. Oh, hello. People are responding. That's neat. So abnormal function means either increased activity, which we call hypertonicity, or diminished activity, which means hypotonicity, or inappropriate coordination of the pelvic floor musculature. So I'm going to briefly review the anatomy. So the pelvic floor is a combination of multiple muscles with attachments to create a dome-shaped structure, which we call the diaphragm, the pelvic diaphragm, across the bony pelvic outlet. This complex of muscles spans from the pubic bone, which is in the front, to the tailbone or the coccyx in the back, and both sides of the pelvis to the ischial tuberosities, which are the sits bones, those bony protuberances right where you're sitting down on. The muscles of the pelvic floor have three functions. The first is to support the pelvic organs, so the bladder, the urethra, the prostate, the anus, and the rectum, along with general support of the intra-abdominal contents. The second function is to contribute to continence of urine and feces, and the third is to contribute to sexual functioning of arousal and orgasm. So let's move on to what are some causes of pelvic floor dysfunction in males. So these are actually applicable to either men and women, the causes, but since we're talking more about male dysfunction, so causes of pelvic floor dysfunction in general are typically multifactorial. So it's not just one thing typically. Some things that are common are learning poor evacuation techniques of your bowels and your bladder, going back to as far as, childhood or even later in adulthood, having surgical trauma to the pelvis, having an abnormal posture, gait, or how you walk and move in space, having skeletal asymmetries. These things can all contribute to developing pelvic muscle pain. A history of sexual abuse, unfortunately, has been associated with developing chronic pelvic pain, and having a degenerative neuromuscular disease, having a spinal nerve injury, having a lower back injury can all contribute to pelvic floor dysfunction as well. Some syndromes that might contribute to pelvic floor dysfunction include irritable bowel syndrome and interstitial cystitis. And then there's some medications that can also contribute to dysfunction of the pelvic floor muscles as well. So let's review what are some of the symptoms of pelvic floor dysfunction in males. So I like to think of the symptoms by breaking it down anatomically with where different structures are located. I think that makes it easier to understand. Also, you can have, just one symptom, or you can have more than one symptom. So it's highly variable depending on your unique situation and what's going on with you. So how we break it down is anterior, middle, or posterior symptoms. So anterior symptoms are things that involve the urethra or the bladder. So some symptoms could include urinary hesitancy, frequency, urgency, discomfort with urination, incontinence, or pain or discomfort in any of those structures. Then middle symptoms are things that involve the genitals. So testicular symptoms, penile pain, testicular pain, or perineal discomfort or pain. So the perineum is the space in between the testicles and the rectum. You can have pain with or following sexual intercourse or erectile dysfunction. And then posterior symptoms, which are things in the back of the pelvis, which are, the anus or the rectum. So having pain or discomfort in any of those locations, having difficulty or straining with bowel movements, or having incomplete evacuation of your stool, having abdominal bloating, constipation, fecal incontinence, leakage, or prolapse from the anus are all possible symptoms as well. So what are some risk factors of pelvic floor dysfunction in males? So similar to what are the causes, the risk factors are also multifactorial, meaning that it's not necessarily one thing. It can be one thing, but it doesn't have to be. Things that we commonly see in the clinic are sports-related injuries. So athletes or weekend warriors, maybe overworking, injuring muscles, etc. Having a high-stress job is a risk factor where you're sitting a lot of time and potentially holding a lot of tension in your pelvis can be a risk factor. Other things include post-operative conditions, so common surgeries that we see in the clinic, having, prostatectomy is a common procedure, an anal fissure procedure or surgery, or a hemorrhoidectomy or a hemorrhoid surgery are all things that we commonly see as risk factors. So what are some things, people can do on their own if you're suffering from pelvic floor dysfunction? There's many things you can try to help yourself if you're suffering. So things that are really easy are things like heat. So applying heat with like a warm bath or a sitz bath can be really helpful. So nerves and blood vessels run together. So you're increasing your blood supply in the pelvis by applying heat with a warm bath. I tend to recommend more moist heat in general. But heating pad with caution, those are also can be helpful. So it's relaxing the pelvic floor muscles by improving the blood supply. Some over-the-counter medications that can be helpful. So if you have constipation and you have high tone or increased tone or tight pelvic floor muscles, we recommend typically magnesium to aid constipation. It's also, in addition to being a laxative, it's also a natural muscle relaxant. So all forms of magnesium have some laxative properties, but some more than others. So that's something you can do if you're struggling with constipation and high tone of your pelvic floor muscles. Also making sure you're getting adequate hydration. So again, that helps with constipation. It helps with blood supply to the pelvis, making sure that you're, drinking enough water every day, staying well hydrated, avoiding certain foods, drinks, chemicals like nicotine, things like that can irritate the bladder. Things like, drinking too much caffeine can be very irritating to the bladder, and decrease blood supply to the pelvic floor as well. There are relaxation techniques that can be helpful. So what I like to recommend for patients is, and typically a starting point, but something you can easily Google on your own, or I'll talk to you about it right now. So is called diaphragmatic breathing, which is belly breathing is the other name for it. I recommend doing that 5 minutes, 1 to 2 times a day. So it's best to get started with this technique by laying flat on your back. And then as it becomes easier, you can do it seated as well. But this is different from your regular day-to-day breathing. Likely we often aren't taking good deep belly breaths. And we're breathing too shallow into our chest. So you want to Typically, I recommend having patients place their hands on their side, either on their flank or their rib cage on the side, to sort of stabilize themselves and feel the movement of their abdomen and their rib cage. So you want to inhale deeply and expand into your abdomen, really. It's as simple as that. And then you want to minimize breathing into your chest. So you don't want your chest to be moving, and that's how you know if you're doing it correctly. And as it becomes easier, you should be able to feel your pelvic floor mobilizing as well. So diaphragmatic breathing, 5 minutes, 1 to 2 times a day. And then also there's some helpful yoga poses, which can help with opening up the pelvis and the hips. So I'm going to give you my top 3 today. So cat-cow with soft elbows is a helpful pose. So if you're not familiar with that pose, it involves being in a quadruped position on the floor. And you're going to think of sort of an angry cat position. So you're going to inhale on angry cat and tilt the pelvis forward, and then exhale on cow to stretch the pelvis. And that can be helpful to really open up the pelvis. And then the second pose is happy baby. So a lot of patients find this to be very helpful if you're struggling with pelvic floor discomfort. So happy baby is where you're flat on your back on the floor, and you're going to bring your hips and your ankles towards your chest to really stretch and open up the pelvis. And then my third pose is goddess pose. So that one's a little bit more challenging for me to tell you about, but I'm going to try. So you might have to Google that one as well, get a picture. But in this position, you're going to be standing, and you're going to place your feet at a 45-degree angle with your feet a little bit past your hip width. And then you're going to bring your hands into the center, sort of in the midline here in your chest. And then you're going to squat down towards the floor while engaging your gluteals and really stretching and opening up the front of your pelvis. So those are my three yoga poses that can be helpful for opening up the pelvis and the hips. So what are some other treatments for pelvic floor dysfunction in men? So typically treatment is a multidisciplinary approach, meaning that it often includes combining treatment with a physician who partners with a pelvic floor physical therapist, and sometimes a psychologist when necessary, depending on what's going on with that person. Treatments can include lifestyle modifications like dietary changes, which I mentioned, specific pelvic floor exercises, medications, physical therapy, injections, and acupuncture. So at Pelvic Rehabilitation Medicine, we also offer ultrasound-guided trigger point injections to the muscles of the pelvic floor and peripheral nerve blocks to help reset the pain loop. I'm seeing some messages here. So I'll open up the floor to any questions that you guys may have about anything, pelvic floor dysfunction or any other topics. So I'm going to go ahead and address the question. So not sure if it was addressed, but someone in my family has been to a urologist for prostatitis and keeps getting antibiotics, but it's not helping. Is there anything else that can help? Sure. So the vast majority of prostatitis is chronic prostatitis, meaning that it's not of a bacterial origin and is derived from the pelvic floor being dysfunctional. Typically, it's increased tone or hypertonicity of the pelvic floor. So similar to what I had mentioned, the multidisciplinary approach here that we offer at Pelvic Rehabilitation Medicine is how we can help people get better. Obviously, you would need to be evaluated by a physician, and then the physician partnering with a pelvic floor physical therapist to help resolve the issue and to develop an individualized treatment plan. So I have another question here. How long is the recovery time for the treatment? So typically, recovery time is anywhere from weeks, depending on really how long things have been going on, to sometimes months if they've been going on for longer. The reason being is that it takes time for nerves and muscles to heal. It's not something typically that happens overnight, and it typically takes, more than one thing in combination. So I have another question here. Are Kegels something that would help? So that's a great question. So Dr. Kegel, who invented the Kegel, which we all know as Kegels now, are indicated for certain types of dysfunction of the pelvic floor musculature, but not all types. So it really depends on, your unique situation and your diagnosis, but Kegels can be helpful for some conditions. Another question, can it go away on its own, or do I require a treatment? So great question. So typically, symptoms do not resolve spontaneously without any treatment, although that would be wonderful if they did. So typically, having an assessment with, your pelvic floor physical therapist, your physician, determining what the problem is, and then helping you make, an individualized treatment program to address whatever your specific condition is, to get you better. Another question, when he sits, he also feels like there's something like a ball when he sits. Is that just from the prostatitis or something else? So, not having examined this person, it can be difficult for me to give individualized recommendations. But this sounds very common to dysfunction of the pelvic floor, and having increased tone of the pelvic floor musculature can create that sensation like you're sitting on a ball or you're sitting on something. Does pelvic floor dysfunction only affect older men? No, pelvic floor dysfunction affects men and women of all ages, from children up to, people, more advanced in their ages. So that's a great question. And another question, will I be out of work post-treatment for some time? Or is there any other downtime after the injection? So that's a great question. So you will, downtime after the injections, the simple answer is no. There's not downtime here at Pelvic Rehabilitation Medicine. We call it back to work in an hour, meaning that the procedure is pretty brief, that we're not sedating you, so you can go back to work, you can drive a car, and it's very minimally invasive. So there's really, you don't have to take a prolonged time off of your job or your school or whatever other things you're busy doing. So can it also cause ED? Yes. So that's a great question. So yes, we covered that in the symptoms. So one symptom is erectile dysfunction. So absolutely, it can contribute to erectile dysfunction. Well, it was really great to have my first Instagram Live. This has been fun. If anybody has any last burning questions, I'm going to wrap it up otherwise, but I'd be happy to see anyone in the clinic for further evaluation. Oh, we have one more question. I know this is about men, but I thought this was something that mostly just affects women. Do you treat the same things? So yeah, a lot of what I covered here today is also very similar symptoms, etiologies in our female populations as well. So there's a lot of crossover. Today I was focused mostly on men, but a lot of the definitions, the anatomy is similar with slight variations for men and women, and the treatment approach is similar depending on the unique patient's needs. All right, guys. Well, I hope you stay warm. I'm gonna try to safely make it back despite the weather here in Texas, and I'd love to see anyone who needs help here in our clinic in Dallas or any of our other locations. Take care.